Good morning, all the students. Today's my demonstration topic is head and neck, Norma, Verticalis and Norma, Frontalis. So this is first demonstration of head and neck region. Then this is the main bone of head and neck. As you all know, is skull. So this is whole skull articulated with mandible at temporomandibular joint. So only movable bone of skull is mandible. So skull includes this part and mandible also. So this is all known as skull. Now skull is also known as cranium. Sometimes this can be also known as cranium. Then what is calvaria and what is brain box? So in calvaria and in brain box, so if we cut the skull from here, so we will get this. This is brain box or calvaria. Fine. This is brain box and this is facial skeleton. This is facial skeleton. So this is brain box. Fine. This is brain box and this is facial skeleton in front. So this is facial skeleton. Now there are bones in many bones in facial skeleton and on superior aspect, that is on Norma, Verticalis. So we can study skull from looking at from its superior aspect. If you look at from superior aspect, it is known as Norma Verticalis. If we study the skull from front side, this is known as Norma Frontalis. If we study skull from lateral side, this is known as Norma Lateralis. And if we study skull from posterior aspect, then it is known as Norma Occipitalis. And from inferior aspect, if we study the skull, that is known as Norma Basalis. Okay. And if we cut the skull cap, so this is interior of skull. So interior of skull. So we will study one by one this all regions and all normas. Now, what is the anatomical position of skull? So in anatomical position of skull, there are two lines are there. One is Reed's base line and another is Frankfurt's horizontal plane. So what is Reed's base line? So this is bony orbit. As you can see, this is bony orbit. And this is external acoustic meatus. Okay, here external ear starts over here. So in cadaver or in living person there is pinna over here, and this is external acoustic meatus. So if we take a horizontal line from infraorbital margin, this is infraorbital margin. This is orbit, bony orbit, and eyeball lies in the bony orbit. This is infraorbital margin. So if we draw a line from infraorbital margin to upper margin of external acoustic meatus, that is known as Frankfurt's horizontal plane. That is known as Frankfurt's horizontal plane. That is from infraorbital margin to upper margin of external acoustic meatus, that is known as Frankfurt's horizontal plane. And what is Reed's baseline? So if we draw imaginary line from infraorbital margin to center of external acoustic meatus, it is known as Reed's baseline. Okay, Reed's baseline. Fine. So two terminology are there. The one is Reed's baseline and another is Frankfurt's horizontal plane for knowing the anatomical position of skull. So we should keep this in Reed's baseline or Frankfurt's horizontal plane for anatomical position of skull, like this. Okay. Now this brain box. This is brain box. So brain box is intramembranous in origin, and the basal part, this is known as basal part, and facial skeleton basal part. It is intra cartilaginous in development. So it is intracartilaginous development, and the bones covering the brain, that is brain box calvaria or brain box bones, that are intramembranous in origin. Fine. So this is skull cap. Fine. It is intramembranous in origin. And if we see the basal aspect of bones, it is cartilaginous in origin. Fine. In ossugation. Now what is diploid? Another term. What is diploid? So diploid, below the age of 4 year or in less than 4 year child, though there are only single bone in this skull cap or bone brain box bones. Only single bone. There is no division. And after 4 years, there is a formation of inner table. This is inner table, and this is outer table. This is inner table. This is outer table. And in between, there is a formation of bone marrow that is known as diploid. So there are 4 diploid veins. There are 4 diploid veins in between the inner table and outer table of skull. So this is inner table of skull, and this is outer table. And over here, this is inner table of skull, this is outer oval of skull, and this is the marrow space containing diploid veins or diploid, that is develops after 4 years of age, and total there are 4 in numbers, and all the diploid vein drains into venous sinuses of brain, dural venous sinuses of brain, okay, surrounding venous sinuses of brain. Now, so as I have said that the bone of skull cap are intramembranous origin. So at the meeting point, this is this is frontal bone, so here this skull, this is frontal bone on frontal aspect. On poshy aspect there is occipital bone. On over this side there is a parietal bone. So all these bones are intramembranous in ossugation. So at meeting point of these bones, that is frontal and parietal and occipital. So there are for frontalis in fetal skull. So there is a membranous in origin. The bones are in membranous origin, and the angle at the meeting point of this membranous bone, there is a membranous gap in fetal skull. This is known as frontalis. So here there is anterior frontanelli. Here it will be posterior frontanelli. On side of that there is anteroinferior frontanelli, and over here there is posterior-inferior frontanelli. So two anteroinferior frontanelli, two posterior-inferior frontanelli, one anterior frontanelli, and one posterior frontanelli. So all the 6 frontanellis are there. So details of the frontalis and usefulness of it we will study later. Now, there are pneumatic bones also in skull. Which are the pneumatic bones? So here we can see this is maxilla, this is frontal bone. So these are ethmoid bones. So these are pneumatic bones, means air containing bone. So what is the use of air containing or pneumatic bone? So it will make the skull lighter in weight, one. Second, it will add resonance to your voice. Third, it maintains the humidity of inspired air. What you inspire, okay. It maintains the humidity, and all these frontalis get infected. So it is known as sinusitis. Okay, sinusitis or inflammation of sinuses, so frontal sinuses or maxillary sinuses. Okay, these are all pneumatic bones, and inflammation of this is known as sinusitis. Now another terminology is emissary veins. So what are the emissary veins? They are the veins which connect the intra means skull intra. Okay, these are the veins which connects the extracranial veins to intracranial veins. So veins which lies over outer aspect of skull, and another veins which lies inner aspect of skull surrounding brain. So emissary vein will connect the intracranial veins with outer cranial veins or extracranial veins. Fine. So it will help to reduce the intracranial pressure. It is known as ICT or intracranial pressure. It will reduce. And another maybe disadvantage of this, that extracranial infection can be transmitted to intracranial venous sinuses, or extracranial infection can get into intravenous sinuses or intracranial, or it can infect the meninges and secondary brains, over this region. So what are the emissary veins? These are the connecting veins which connects the extracranial vein to intracranial veins. Now, one another thing is bones within the middle ear cavity. You must be all knowing that 3 bones are there, that is malleus, incus and stapes inside the middle ear. Fine. So ear has 3 components: external ear, middle ear and internal ear. So in middle ear cavity there is 3 bones known as malleus, incus and stapes. These are known as bones within bone. Bones within bone. Inside the middle ear cavity there is bones within. Another is the densest bone of body, that is petrous temporal bone. This is petrous temporal bone. Densest bone of body. So easily seen from NT aspect of study. Densest bone of body, that is petrous temporal bone. Now, what is vertex? Vertex. So the highest point on skull cap, that is known as vertex. Fine. Another terminology, what is vault? So this is vault or covering of brain box from anterior, superior and posterior aspect. This is known as vault, and highest point of this is known as vertex. Now, we'll study about Norma Verticalis. So now we will study Norma Verticalis, how it can be seen. So if you see the skull from superior aspect, so it is oval in shape, it is narrow in front and broader behind. Okay, broader in behind, so oval in shape. Norma Verticalis. If you see skull from superior aspect, this is known as Norma Verticalis. Fine. So which are the bones you will be able to see? This is frontal bone. These are parietal bone and upper part of occipital bone. So these are the bones you can see in Norma Verticalis. And what are the sutures? Sutures are joints between these bones. Cranial bone, joints between cranial bones is known as sutures. So this is the joint between frontal bone and both the parietal bone is known as coronal suture. This is coronal suture. Now, joint between 2 parietal bones is known as sagittal suture. This is sagittal suture. And joint between 2 parietal bone or suture between 2 parietal bone and occipital bone is known as lambdoid suture. This is lambdoid suture. Fine. Now, the junction between, so connection between or connecting point between coronal suture and sagittal suture, this, it is known as bregma. This is known as bregma. Fine. And junction and anterior frontanelli lies over here. It is known as bregma. And junction between sagittal suture and lambdoid suture, this, it is known as lambda. It is known as lambda. Fine. Now, another terminology is parietal foramen. Fine. This is skull cap. So these are suture. This is zigzag line. What is parietal foramen. So here you are able to see one foramen. I am keeping the pinpoint of pencil over here. This is parietal foramen. So it will, there are two foramen, one here and one over here. So 4 to 5 centimeter in front of lambda, 4 to 5 centimeter in front of lambda on sagittal suture. There is two foramen over here. This is known as parietal foramen. So the structure passing through this foramen is parietal emissary vein. Parietal emissary, which connects the superior sagittal sinus, which is intracranial sinus, with sinuses or veins of skull. This is over soft tissue over skull cap is known as skull. Fine. So this is parietal emissary foramen. Okay. Now, in some skull, we are able to find another suture in frontal bone. So in this skull, there are no any suture in frontal bone. But here we are able to find a suture in frontal bone. So this suture is known as metopic suture. This is known as metopic suture, and it is present in about 3 to 8% of people only. 3 to 8% of people only will have this metopic suture, and generally this appears by the age of 6 years. Generally this appears by the age of 6 years. So another thing you are able to find on Norma verticalis is two parietal lines. One is superior temporal line and one is inferior temporal line. So you will study this temporal lines in detail in Norma lateralis, but here some part of this line you can able to see. Fine. So these are two lines are over there. One is superior temporal line, and inferior to it there is inferior temporal line. So on both aspects you can see this is superior temporal line and inferior to it inferior temporal line. Okay. Now, so this is all about Norma verticalis. Fine. The main features I have say the bones and sutures and bregma and lambdoid and two emissary foramen. Okay. One terminology left is obelion. What is obelion? So part of the sagittal suture in between, two parietal foramen is known as obelion. O-B-E-L-I-O-N. Obelion. This is obelion. And most prominent point on parietal bone is known as parietal eminence or parietal tuberans. Parietal eminence. These are parietal tuber or parietal eminence. Most prominent point on parietal bone. It is the weakest point of parietal bone. It gets easily fractured. Fine. Now we will study Norma frontalis. So what we will able to see in front from seeing the skull from frontal aspect. Yes. So this is Norma frontalis, which includes the mandible also. Only movable bone of skull is known as mandible. So which are the structures we are able to see? So this is frontal bone. These are the bony orbit. These are the bony orbits over here. Bony orbits. Fine. Another bones are, these are maxillary bones. These are maxillary bone, which forms the upper jaw. This is upper jaw. Lower jaw is formed by mandible and upper jaw is formed by maxilla. So this is upper jaw, which is formed by maxilla. So these are maxilla. These are malar bone or cheek bone. This is zygomatic. This is zygomatic bone, also known as malar bone or cheek bone. Fine. So this is zygomatic bone. This is frontal bone. This is zygomatic bone. This is maxilla. Both maxilla. These are nasal bones. Very good. Nasal bones. Most commonly fractured bone of front face or from frontal aspect. In Norma frontalis, most commonly fractured bone is nasal bone. So this is nasal bone. Fine. Now, Now on frontal bone, we are able to find two superciliary arches. We have eyebrows in cadaver or a live person, and in skull there are elevation from in lower aspect of frontal bone over here. This is known as superciliary arches. This is known as superciliary arches. And also there are two frontal prominence or frontal eminence over here. So these are more prominent in females and children. Which are they? Here. These are known as frontal eminence or frontal tuber. These are superciliary arches, and meeting point of these superciliary arches is known as glabella. It is known as glabella. Fine. Okay. It is known as glabella. Now, and bony orbit. So this is supraorbital margin. This is infraorbital margin. This is medial orbital margin, and this is lateral orbital margin. It will contain eyeball, right? Or bony orbit will contain eyeball. So this is bony orbit, this is supraorbital margin, this is infraorbital margin, this is medial orbital margin, and this is lateral orbital margin. So in supraorbital margin, there is a notch at the junction of medial 1/3 and lateral 1/3. A notch or foramina will be there. If there is a notch, it is known as supraorbital notch, and if it is converted into foramen, this is known as supraorbital foramen. Fine. So supraorbital margin is formed mainly by frontal bone, as you are able to see. It is formed by frontal bone. Then infraorbital margin. It is formed mainly by maxilla, and on lateral side by zygomatic. It is mainly by maxilla and lateral aspect by zygomatic. And this is infraorbital foramen. So it is found on anti-aspect of frontal bone, maxillary bone. This is infraorbital foramen. Okay, this is infraorbital foramen. This is supraorbital notch or supraorbital foramen. If it is notch, then we will call it notch, and if it is converted into foramen, then it is known as supraorbital foramen. So this is infraorbital foramen. This is supraorbital notch. Now, the lateral orbital margin, which is formed by zygomatic process of frontal bone. See, this is known as zygomatic process of frontal bone, and it is supplemented in lower aspect by frontal process of zygomatic bone. This is frontal process of zygomatic bone. So, zygomatic process of frontal bone and frontal process of zygomatic bone, which will form the lateral orbital margin. Now medial orbital margin. Medial orbital margin will be formed by frontal process of maxilla. This is frontal process of maxilla. And behind to it, there is a lacrimal bone. A thin plate of bone is known as lacrimal. It will be found over here. This. Okay, so it is known as lacrimal. Fine. So it will form the medial orbital margin. And here, this is medial orbital margin. Fine. Now, as we also said that there are two nasal bone over here. One is this, and second one is this. So, nasal bone are connected with each other. Is known the suture connecting both nasal bone is known as internasal suture. Then, the suture between nasal bone and frontal bone is known as frontonasal suture. Frontonasal suture. And a suture connecting frontal process of maxilla and nasal bone is known as nasomaxillary suture. Here, nasomaxillary suture. Fine. Now, meeting point of frontonasal suture and internasal suture. Here, it is known as inion. Fine. So, it is known as nasion. Connecting point junction between frontonasal suture and internasal suture. Here, it is known as nasion. It is known as nasion. Now, below to it, this is the anterior bony nasal aperture. Anterior bony nasal aperture. This is anterior bony nasal aperture. which is formed by lower margin of nasal bone, then nasal notch on maxilla. This is a nasal notch on maxilla, and a medial aspect of maxilla. This is anterior nasal spine. It is known as anterior nasal spine. So it is anterior bony aperture of nose. Fine. Now, other features of maxilla. So here it is upper jaw, and there are two incisor tooth will be there here, two incisor tooth, and lateral tooth there is a canine tooth. Fine. In lower marginal means upper jaw there are tooth formula like two incisor, medial incisor, lateral incisor, then lateral to it canine tooth will be there. So a fossa above the incisor tooth is known as incisor fossa. This is incisor fossa. A fossa above incisor tooth is known as incisor fossa, and the eminence above canine tooth is known as canine eminence. So here it is canine eminence, here it is canine eminence, and here it is incisor fossa. This is incisor fossa, this is incisor fossa, this is canine eminence, this is canine eminence. Okay. So these are the features of maxillary bone. So maxilla articulates with frontal bone, with frontal process of maxilla, with nasal bone, with on opposite side maxilla, and with zygomatic bone. So here it articulates with zygomatic bone. So features over here, one is infraorbital foramen, incisor fossa, canine eminence, anterior nasal aperture, anterior nasal spine. Okay. Now, on zygomatic bone, there is a foramen. One single minute foramen is there. Okay. It is known as zygomaticofacial foramen. This is known as zygomaticofacial foramen. Okay. Now, in mandible, if we see in mandible, so mandible will articulate with rest of the skull by TM. Okay, temporomandibular joint. So it will articulate like this. Fine. Okay. TM joint, temporomandibular, temporal bone of skull. Okay. So this is lower jaw. Fine. This is lower jaw, only movable bone of skull, lower jaw. So this is a lower alveolar teeth and lower alveolar margin, which is formed by lower alveolar margin is formed by mandible. So mandible has ramus and mandible has body. So here we are both side of mandible fuse in median line. Okay, in center with at symphysis menti. So this is known as symphysis menti, and a triangular area. A triangular area here on symphysis menti. This. So this is known as mental protuberance, and two tubercles infralateral to it, it is known as mental tubercles. Fine. So mental protuberance, triangular area, and mental tubercles. Two mental foramens are also there here. This is known as mental foramen. So mental nerves and vessels come out from over here. Mental nerves and vessels will come out from this foramen. Fine. So this is mental foramen. So we'll study mandible later on in a separate demonstration. So structures passing through supraorbital notch. So supraorbital nerves and vessels will pass through supraorbital notch. Structure passing through infraorbital foramen. Infraorbital nerves and vessels will pass through, come out through this foramen, and structure passing through zygomaticofacial foramen, that is zygomaticofacial nerve, and structure passing through mental foramen is mental nerve and vessels, which comes out through this foramen. So this is all about the bones, Norma frontalis. Okay, so to another terminology, one is rhinion. So lowermost margin of nasal bone is known as rhinion, and lowermost margin of symphysis mentally. This is known as Natheon. Natheon. The G is silent. Gnathion. Natheon. So we will end our demonstration topic 3. So we have completed 2 parts of skull, Norma verticalis and Norma frontalis. Thank you.